We'll have 3 participants, 3 lecturers this first part of the afternoon. I will ask them to come up here, make their presentation, and after they finish, to take one of the chairs and wait for the next presenter, and then the third presenter, and then we start Q&A. I will initially invite Dr. Giancarlo Lucchetti to tell us about his studies on spirituality in health education, current status, and future challenges. Dr. Lucchetti is a general practitioner, a fellowship-trained geriatrician, and a PhD student from the Federal University of São Paulo. Currently, he coordinates the research department of the São Paulo Medical Spiritist Association and the Hospital João Evangelista. He is the author of several articles regarding spirituality and health in journals, such as the Journal of Rehabilitation Medicine, Medical Education, Family Medicine, Circulation Substance Use and Misuse, and Evidence-Based Complementary and Alternative Medicine. And he is very fast. He's already here.
Well, thank you. And first, my profile is outdated. Sorry about that, but now I'm working at the Federal University of Juiz de Fora. I'm an associate professor there. And I have my PhD in neurology in the Federal University of São Paulo. And today I'm going to talk about spirituality in health education. I will focus on the medical education, that's my field of research. And I'm going to talk about the current status and future challenges. Okay. So as a brief introduction, religion and spirituality have been connected to medicine for centuries. That's history of medicine. And hospitals and universities originally were grounded by religious temples or societies. Since the 60s, 50s and 60s, epidemiological studies started to show the impact of religious beliefs, spiritual beliefs, to the patient health, and triggered a lot of research on this subject. So the first question is, why we should care about spirituality in patient care? Well, I'm going to present this book for you. That's Spirituality in Patient Care from Harold Koenig. He's from Duke University. It's the most productive author of all times in spirituality and health. And he presented to us 4 motives. The first one, religious beliefs and spiritual needs are common among patients. And many of our patients would like we as doctors to address these issues. The second one is that religious beliefs impact medical decision-making. Third one, there is a relationship between spirituality and health based on scientific articles, based on research. And supporting a patient's spirituality can enrich the patient-physician relationship. So here are 4 motives. And first, there are some research that are trying to see if the patient would like to discuss spiritual issues or beliefs with a doctor. So here you can see McCord, Ethan, myself, Alice, Williams, we have here yes. So they want to discuss. It varies from 41% to 94%. At least 8 or 9 in each 10 patients would like to discuss these topics with their doctors. Here is about some physicians. So here is the patient asked about, has your doctor or health professional ever inquired, ever asked about your spiritual needs? So we can see that, yes, only 10 to 30%. So the patients want to discuss these issues. However, the physicians don't discuss this issue. Here, there are some studies asking doctors, should a doctor be aware of spiritual or religious beliefs? We can see here that doctors agree that they should be aware of spiritual religious beliefs. We can see here 80%, 58%, 82%, 83%. So they believe it's needed. Here is a study, a collaborative study of 6 continents. We in Brazil are participating in this study. That's the NERSH International Collaboration, that are trying to compare the attitudes about physicians concerning this issue of spirituality and religious. We can see here those countries involved in the study. This is a question in general. Is it appropriate or inappropriate for a physician to discuss religious, spiritual issues when a patient brings them up? So physicians are telling that. Indonesia, 90%, Brazil, 99%, Austria, 96%, USA, 92%, Denmark, 83%, Congo, 67%. In other words, we can see here clearly that the physician thinks it's appropriate or inappropriate to discuss religious beliefs with patients. So they believe usually appropriate or always appropriate. So 9 out of 10 physicians believe it's appropriate to discuss these issues when a patient brings them up. It's clearly to me that the physicians think this way. I believe spirituality is important to my patient, but I do not address. On the other hand, the patient wants the physicians to ask about spiritual religious beliefs. So we have this view of the physicians and this conflicting view of physicians against patients' views. And why does it happen? Here are some barriers. We can see here the reasons, some studies showing the reasons: lack of knowledge, lack of training, lack of time, fear of offending the patients. It's not my job, a physician telling, oh, it's not my job. This is a job of a religious leader. It's not my job. We can see here either disapproval of my colleagues. So we have several barriers that preclude the addressing of these issues. But what is the scientific evidence for that? Well, first, this is a database, the PubMed, an article database. We can see when we add the keywords spirituality or religious, we can see 60,000 articles. So a lot of publications concerning these issues, these topics. In the last year, we can see here that 6 articles per day were published in the last year. So a lot of articles have been published in the last decade. In the last 15 years, we can see the rise, the increasing number of articles published in PubMed. And here are the most productive countries. We can see that the United States is the first one. Most of the international publications are from the United States, including the spirituality and health publications. We can see also that United Kingdom, Canada, Australia, Germany, India, and Brazil. So we have a lot of publications here in the United States. And some of the scientific evidence, for instance, quality of life. We have several studies showing that usually those who have higher spiritual and religious beliefs have better quality of life. Depression. Lower prevalence and faster remission of depression. Anxiety, lower prevalence of anxiety. Mortality, lower mortality. Some studies show that those who have high spirituality and high religiosity have at least 7 years more of survival than those who didn't have. Treatment compliance, better compliance. Substance abuse, less substance abuse. Health behaviors, better health behaviors. Well-being, greater hope. Suicide rates, lower suicide rates. So we have a lot of evidence showing that spirituality, religiosity can impact patients' health. How about in health education? Well, this is the number of US medical schools which provide teaching on religious and spiritual issues as applied to medicine. We can see here that in 1993, there were only 3 medical schools here in the United States that have such courses. In 2007, it was 100. We have here in the United States 122 medical schools, so 100 medical schools have such courses. Here is another study showing by Harvard Koenig, showing that 90% of medical schools have courses or content on spirituality and health here in the United States. 73% with content in required courses. So they have this content, but it's an ethical course, it's in a clinical skills course, it's a palliative care course, not a specific spirituality and health course. It's surprising that only 7% of these courses are dedicated exclusively for spirituality and health. So they have a lot of content, but few courses. However, some US universities are investigating this issue and are seriously investigating these issues. For instance, the Duke University, Minnesota, Florida, Indiana State, Harvard University, Stanford University, and of course, I should mention to you, the George Washington Institute for Spirituality and Health, the Jewish. Here is Christina Puchalski. She's one of the most important researchers and one of the most important educators in this field of spirituality and health. I had the pleasure of met her in 2012, and here is her institute at George Washington. So she's very important for the field of medical education, especially dealing with spirituality and health. So we have here in Washington a very important person that have contributed a lot to the development of spirituality in medical education. How about United Kingdom? We have a study at Medical Education, the Journal Medical Education, 2008, showing that 59% of UK medical schools have content on spirituality and health. But these courses are a global reality. So this is a study published at the Journal of Religion and Health, 2012, showing that at the time, 2011, we have a lot of studies in the United States, Canada, a few studies in Europe, and no studies in Latin America, Asia, Africa, and Oceania. So we have a lack of studies in other countries. Most studies were from the US reality and in Canada. How about in Brazil? We have, in 2012, published this paper. It's Spirituality and Health in the Curriculum of Medical Schools in Brazil, showing that we have there, at that moment, 180 medical schools, and only 10.4% of the Brazilian medical schools have a mandatory, a dedicated spirituality and health courses. 40% of the medical schools in Brazil have content on spirituality and health. However, only 2 medical schools have spirituality and health courses that involve hands-on training, so they are most theoretical. And 3 schools have spirituality and health courses that teach how to carry out a spiritual history. So the courses at the moment were not practical. So most of medical directors, to our surprise, almost 90% of medical directors believe that spirituality and health was an important thing to teach in their schools. So we can see here that medical directors believe it's important, but they don't add this content into the curriculum. How about medical teachers' opinions? How about faculty opinions? Well, that's a study published in Medical Teacher in Brazil. 72% of the medical teachers believe that faith or spirituality can influence the treatment of their patients in a positive way. 75% believe that prayer could have effects in the patient's treatment. 62% want to address spirituality with patients. Half of the patients believed that it's important for a medical school to prepare students for this issue. However, only 43% reported that they, as medical teachers, felt prepared to address this issue. And 27% have ever mentioned this issue in their classes. And 9 out of 10 felt that the Brazilian medical schools, at the moment, were not given all required information in this field. So we can see, again, they think it's important, they think that can impact patients' life, they think it's important for them to teach this issue for their students. However, in practice, nothing happens. And how about medical students' opinions? Here is a student that I was the principal investigator here. It's called SBRAME. It's a multi-center study. SBRAME is Spirituality and Brazilian Medical Education. So it embraces 12 Brazilian medical schools. We can see here the logos of the medical schools. Here is the research team. And we have evaluated 3,630 medical students. It's a 61% response rate. Here are some of the opinions of our medical students in Brazil. For instance, does spirituality impact the health of patients? We can see here that 70% said a lot. So, yes, spirituality has an impact on the health of patients. 24% somewhat, 5% not at all. And we asked, is the influence positive or negative? 68% believe only positive, and 5% only negative, and 25% both positive and negative. Again, do you want to address your patients' spiritual and religious issues? 60% yes, we want to address these issues. But do you feel prepared to do so? We can see here that 48% said, no, I'm not prepared to do that because I did not have training to do that. And only 11% felt prepared to do that. And how relevant is the approach of spirituality for a doctor? A lot. 30%, somewhat, 45%. A little or not relevant, only a quarter of the students. Have you ever addressed patients' spiritual and religious beliefs, 64% said yes, no, yes, and 36% no. And okay, you have ever addressed, but how often do you address this issue? You can see here that often 23%. So they have ever addressed, but not often. And which barriers discourage you to discuss these issues? Here we can see that fear of imposing religious beliefs, fear of offending the patients, lack of knowledge, and lack of time. We can see that the first three, fear of imposing religious beliefs, fear of offending the patients, lack of knowledge, can be solved by training our students. So if we provide training for them, the main motives, the main barriers can be solved. Okay, so what should we do with our students? We have some teaching strategies that we can try to overcome these barriers, to help them to treat this issue with comfort. So, first, taking spiritual history. We need to train our students to perform, to do a spiritual history, to ask for the patient about these issues. Shadowing a hospital chaplain. So, it's another important thing that we can do, that they shadow the chaplaincy service in the hospital. Journal clubs, so we can discuss spirituality and health articles with our students. We can discuss the research that we have, the evidence that we have with our students. Another strategy is to visit palliative care patients, because in palliative care we have a lot of these issues are very common. So the students can go there and discuss these issues with the patients. Another strategy is the standardized patients, the SPs. So in order to train the students, they can become more comfortable if we have standardized patients that simulate some situations. So we can do that with the medical students. Here's an example in Brazil about this strategy. We can assess, we can evaluate these students doing an OSCE. OSCE is an objective structured clinical examination. So we can give them grades if they want to evaluate them, if they are carrying out appropriately this approach, this addressing. And of course, we can do undergraduate research. Here is a research that I would cite to you. That's from Rodolfo Furlan Damiano. Rodolfo is here, and he's a student, but he did this research. It's a collaboration between SIU, Southern Illinois, and the Federal University of Juiz de Fora, and Pontifícia Universidade Católica. That's another university in Brazil. And this study has been accepted by Teaching and Learning Medicine 2016. So yes, we can do that. We can improve the knowledge of this issue doing some undergrad research. Rodolfo are going to present this study after my talk here. And here is a paper that we have published in a Journal of Religion and Health showing how can we implement a spirituality course in a medical school. So the title of the paper is Learning from Listening, Helping Healthcare Students to Understand Spiritual Assessment in Clinical Practice. It's from another study, another undergrad student, Lydia Gonçalves, that now she's a physician. And that's the incorporation, the integration of a spirituality course in a medical school in Brazil. Here are the topics that were delivered for the students. For instance, what's spirituality? What's important to address spirituality? Why is it important to address spirituality with patients? How can we approach spirituality in clinical practice? When is it appropriate? What may result? Limits, barriers, approaching spirituality, religious spiritual coping, FICA spiritual assessment tool. FICA is a tool that we use for to do a spiritual history. So it was developed by Christina Puchalski here at the George Washington University. Palliative care, bioethics, interface mind-brain, near-death experiences. So that's our course in the medical school of Mato Grosso there. So a total of 363 patients were interviewed by the medical students. 60% of students felt comfortable taking a spiritual history with these patients. 85% believed the patient liked the approach. So the students gained more confidence. They were more secure to do that. 72% believed more benefits could come with a follow-up. And it's very interesting because when students felt more comfortable, they tended to believe that the patient liked the approach, the patient felt better, and students tend to be more motivated in applying, in doing the spiritual history. So we concluded this paper saying that spirituality and health educational strategies may be a valid strategy to prepare future health professionals to face spiritual issues in health scenarios. So, I believe this is a stop sign. We need to think about that. We need to think that the patient is not only the biological, is not only a machine. We need to think further. I like a lot this slide because it says medical evolution. We have here 1808 and 2008. And you can see the first slide showing that all physicians, all doctors are looking to the patient, are talking to the patient, are examining the patient. On the other hand, 200 years after, we have here the technology. The technology is a very good tool, I believe that, but we cannot do that to our patients. We can see here the patient alone, looking sad, and all physicians looking for into a machine. These are EKG, an ultrasound, or something like that. And we forgot that we have a human being there. So we forgot that we are dealing with human beings. And our students are forgetting that we are dealing with human beings. That we are not dealing with a disease, examinations, that we are dealing with bio-psycho-social spiritual being, that every dimension is important, that every aspect of the human being can promote health or can be responsible for a disease. So I believe the spiritual and religious beliefs are important to be recognized because we are dealing with a complex human being that's not only a machine. So, trying to assess this dimension of the spirituality, religiosity, is important for the new era of medicine. My conclusions for this talk are, although the implementation of spirituality in medical schools is happening in several countries, and we have that, a lot of countries are researching, are working with these issues, there are still barriers to develop and teach courses in spirituality and health, as well as integrate spirituality more fully into clinical practice. More studies are needed in order to evaluate the impact of these courses on the students' skills and behaviors, and to implement tools which could enable students to provide an integrative and humanistic care. So, thank you. I'm open for the questions after this presentation.
Dr. Lucchetti, if you prefer, you may go back to your seat so that you can see the projection as well. Thank you. And I apologize for misreading your bio. I have two versions of your bio, and indeed, you are a doctor in neurology and neurosciences and assistant professor of the University Federal of Juiz de Fora in Brazil.